Of Dr. Tori, who is basically an artificial intelligence. And in this presentation, we'll go through a case of an infant baby girl who suffers from respiratory distress. So, this is an actual case. The girl is only 6 months old, but because it accepts only age in year, so we will give 0 0.5. The gender would be female. The body weight is 7 kg only. The country is set to India by default, and the complaint is this that the patient is suffering from respiratory distress for 1 month, and there was a fever also for 2 days. And basically, the patient consulted a few local doctors who gave some antibiotics, mostly cephalosporin group of antibiotics that did not work. And then we'll also attach some image files uh, that we do have some x-ray report and some blood blood report as well, so we can just attach them. There is also option to attach PDF files as well, but here there is no PDF file, so we'll just go to the our next page. So in the next page, there are few more fields. So first question it asks is that please mention the treatment you have taken so far. We have already stated that she was given antibiotics, and also some additional thing I like to mention here is that she was also given salbutamol and budecort nebulization and montelukast levocetirizine for symptomatic treatment. All right. So that was about the previous treatments, and then it asks that if there is any other disorder that you would like to mention, but there is no such known disorders, so no disease. Please mention if you have any drug allergy, none that we know of. Then we move to the next page. Okay. Then basically it asks few more questions. Then first question is when you check the temperature, how high was the fever? So it was 101 to 102 degree Fahrenheit. That was the uh, peak temperature. Then it asks about the breathing difficulty. It was same, getting worse or better over this month. So it was consist. Let me see the options. Um, so it was basically was the same. It was staying the same. Does the child have a cough? If so, how do you describe it? Yes, there was some cough with phlegm. Yes, it was there. Any trouble with the feeding? No, there was no such, but yes, there was occasional coughing with feeding. Uh, was any previous medical issue or hospital visits? Yes, actually, the child got admitted to hospital for the same reason a few weeks before, so I think I should mention it here. Yes, the child got admitted to hospital uh, 2 weeks back for the same reason. Is there any family history of asthma allergy? Yes, the father actually has asthma. Then any improvement with antibiotics? There was only very slight improvement. Of course, it was not improving with the antibiotics. That's why we were then decided to take a second opinion, and the child was moved to a big hospital. And we are actually here, uh, using this actual this artificial intelligence, and then we'll match its response with the actual treatment she got from that hospital. So this is what we are going to do. Well, is the child up to date with vaccinations? Yes, it was. The child was, of course, updated with the vaccinations at that point of time. Yes, so let's go to the next and the final phase. So now this AI will give the opinion. So we will then match the opinion with what the child actually got, because this is a these are already done test. The child is now okay, uh, and we will now, you know, compare the similarities and will compare and contrast between this AI agent versus what the child actually got in that hospital. And by doing that, we will get an idea of what the artificial intelligence is really capable of doing. So a little bit, while the page loads, a little bit about this model's architecture. The model is powered by GPT-4, of course. It's powered by GPT-4, but it's heavily customized for medical purposes. So let's see. This is the opinion. So there is an urgent chest X-ray is required. That is the initial evaluation, and penoxygen saturation is very much needed. Suggested medication is not much. Salbutamol inhalation and paracetamol oral solution. So, uh, so basically, the it does not give antibiotic. It just asks for symptomatic management, and it mainly, it wants the investigation to be the priority. Then the investigation stage one, it suggests complete blood count, a blood culture, a chest X-ray, and nasopharyngeal swab for viral panel. This is exactly what that hospital did. They went straight away for the blood culture and this viral panel. And after that, they actually, discovered pseudomonas. It was an unfortunate case, but finally the child recovered, so it's okay. So anyway, that was farther in the future. So at that point, it did not know that, of course. So it just suggests blood culture and nasopharyngeal swab. Stage two, it also suggests sweat chloride test and echocardiogram. So that was an advanced level of thinking that fortunately we did not have to go through. And finally, it gives some advice that maintain a calm environment to avoid agitation, keep the child well hydrated, and finally, it also gives the explanation behind the opinion. So why it suggests this particular chart? There was an explanation. Priority to urgency: given the history and the age, there is a high suspicion of a serious underlying condition. Minimal intervention due to age. So opted for supportive care with salbutamol for possible reactive airways and paracetamol for fever control. So here it gives the logic why the empirical antibiotic was not started, and why uh, the investigations was given more importance. Then testing to differentiate and diagnose. So CBC, blood culture, and chest X-ray with immediate insight, viral panel. So it's stressed for the right diagnosis, which is of course the right thing to do here. And salbutamol was selected based on family history suggestive of reactive airway component. So it basically correlates with all the medical history, and which is actually a pretty good decision in my opinion. Paracetamol for antibiotic needs, bearing in mind the weight adjusted dosing for infants. Yes, so paracetamol, it also adjusts the weight. It gives administer 0.5 ml every 4 to 6 hours as needed for fever, not exceed 5 doses in 24 hours. So it just, you know, it also calculates the dosage for salbutamol, 2 puffs every 6 hours as needed, like that. And also, of course, it gives a marking for prescription only drugs, so that basically this opinion is should be used as a second opinion only and not to be used as a prescription. So of course, for any drug which is a prescription only drug, it comes with this red marking. So that's it. That is to demonstrate the artificial intelligence story. So this is not yet available for the public to use. So I'm just in testing this, and I'm trying to make it available for public to use as soon as possible. Thank you for watching this demo.